अच्छा शुगर कितना रही है थोड़ी?
शुगर
10.34 ਦੀ ਰੇਂਜ ਰਹੀ ਹੈ ਇੱਕ ਦਿਨ 8.5 ਸੀਗੀ
अच्छा अच्छा
ਦੋ ਵਾਰ ਸੀਗੀ 8.5
10.3 है
ਹਾਂਜੀ
इंसुलिन ਤਾਂ ਨਹੀਂ ਲਗਾਈ?
ਨਹੀਂ
अच्छा ਪਹਿਲਾਂ ਇੰਸੂਲਿਨ ਚੱਲਦੀ ਸੀ?
ਪਹਿਲੇ
ਪਹਿਲਾਂ ਕਿੰਨੀ ਚੱਲਦੀ ਸੀ ਇੰਸੂਲਿਨ?
200
200 यूनिट्स
yeah
Every
day
day, huh?
every day
अच्छा 200 यूनिट्स लगा के कितनी रहनी सी थोड़ी
12
12 now without any insulin
yeah
now it is 10 and at times it is 8
yeah
okay so
but I think once a while I have to take a pill, you know.
yes you must take better would be to keep it around 7 or 8 even if you have to take a pill or half even 2 pills no problem even sometimes you have to take 10 units 20 units insulin as well
Okay.
because our target is to keep sugar just average. It should not be very low as well. Should not be around 6 because MGB is very strong tool
Okay.
and you'll be losing weight every day. And there is a bypass as well. It's pushing out a lot of sugars. So you should keep it around 8.
Okay.
If you try to keep it around 6, it might actually go down.
Yeah.
So just be careful. We fear low sugar after surgery.
Okay.
Moderately high sugar is no problem because eventually it will be under control.
Okay.
As you have seen, not using any insulin, still it's
Yeah.
better than
Yeah,
what it
whatever.
used to be with insulin. So this is the power of gastric bypass.
Right.
And earlier we used to think that this sugar control comes because of weight loss. But as you have seen, it's only 7 days.
Yeah.
And right from day 1 of surgery, you are not taking insulin.
Right. That's
So then how is it, that without insulin, how's your sugar under control? This is gastric bypass, mini gastric bypass. Because now food is going 6 feet down.
okay.
So it's touching a different point of intestine. This is a brand new concept.
Okay.
Earlier we used to think that it's only the pancreas which is producing the insulin, the beta cells, or the peripheral resistance of the body, like in type 2 diabetes. So we used to think that this is the mechanism of control of diabetes. But the jejunum, this is now the third portal which is coming up as a new concept because we see this every day happening to our patients. Their diabetes comes under control like this after gastric bypass. So what's the reason? The food is not touching the D1, the first part of the duodenum. It's going down to the mid part of the jejunum or maybe even further if we do a longer bypass. So as you are a surgeon and even you are a doctor or radiologist, you can understand this very easily. The stimulus to the pancreas has to come from the intestine. So in this case, the stimulus is stronger. And we have checked the insulin levels after MGB. If you give her anything to eat, anything to drink, and after 30 minutes you check the insulin levels. Insulin levels before surgery are here. Insulin levels after surgery are here because the new point of the intestine gives a push to the pancreas, gives a push to the beta cells of the pancreas. And how is that push working? It's because of certain hormones. We know the gut hormones. Gut hormones control everything. So these are the gut hormones which are giving new high amplitude signals to the beta cells to produce more insulin. So it's a sudden kick, sudden push to the beta cells, which gives you better control of type 2 diabetes. But in type 1 diabetes, this kick is not there because beta cells are already gone. But in type 2 diabetes, as beta cells are good, so they can be better stimulated if the signal is coming from a different part of the intestine, which had never seen such high levels of sugars. Because if you can see the mid part of the jejunum, it had not seen high levels of sugars in the food because the chyle which is flowing through the jejunum, it doesn't have that much of sugar as it has now, because most of the sugar would get absorbed in the first part of the duodenum and the first part of the jejunum. Now whatever she's eating is being directly delivered to the 6 feet point, and that point had not seen such high levels of sugars. So that's the reason. It might be peptide YY or GLP-1, GLP-2, you can name 100 different hormones, but this is a simple concept which we can say that it works. And in addition to this, when you lose weight, it further becomes better. And I have seen if you can maintain your weight well, then you can maintain this control over diabetes well. But we should never think that it's a cure. We cannot cure diabetes. We can only treat it. It's under control. Down the line, 7, 8, 10 years, if you start putting on weight again, diabetes can come back again. So there was a big controversy between the medical doctors and the surgical specialists on this issue. They used to say that this is bariatric surgery and it has got nothing to do with diabetes. But as we saw every day this is happening, now there is a kind of consensus. We don't say that we cure the diabetes, we just control it. And as you have seen, 200 units of insulin every day and 1 dose of MGB. It's stronger than 200 units of insulin. So that's very clear in this case because she has not used insulin after surgery.
Really?
Yes.
No.
She was taking 200 units every day and
beside
the
that she was
blood sugar
taking-
used to be 12 plus.
She was taking 2 pills in the morning with the insulin, 2 pills in the evening. 4
Okay.
pills also.
4 pills plus 200
insulin.
units of insulin. MGB is stronger than 4 pills plus 200 units of insulin. So that is the reason.